your Tuesday evening health watch, the HIV epidemic impacts people across the country, but southern states account for more than 50% of new HIV cases annually, according to the Centers for Disease Control and Prevention. 9 Your Sign's Ariana Kraft shows us how communities here in the East are working to find solutions.
There are many factors that contribute to the rising HIV epidemic in the South.
What we recognize in the South is that shame and isolation lead to very negative health outcomes. And when there is a lack of accurate information around HIV, folks tend to be less likely to be engaged in care and to feel socially supported in their communities.
According to the Centers for Disease Control and Prevention, the impact of HIV in the South also varies by race. African Americans are disproportionately impacted, accounting for 53% of new HIV diagnoses in 2017. And they say poverty and unemployment could be contributing to the higher concentration of HIV and other chronic diseases in the southern region.
The main problem that we see is people not being tested. So a lot of persons who are infected don't know they have infection.
Access barriers also are preventing people from receiving adequate HIV and healthcare services. The Southern AIDS Coalition is part of the Gilead Compass initiative that works to build on community-driven solutions when it comes to this disease. And one organization here in Greenville is part of this effort.
So Circle of Friends is one of 11 organizations that were identified by our grant review committee as having an idea that they felt would really meaningfully address HIV-related stigma in North Carolina.
They're receiving a $40,000 transformative grant to implement LAMPS, that stands for Leaders Advocating Mentoring Personal Growth and Support Program. It will begin in January of 2020. In Greenville, Ariana Kraft, 9 on your side.